Let me start.
Hello, good afternoon. My name is Dr. Kolawole. Welcome to another interesting session. Today we'll be talking about an interesting topic, hepatitis, which we all need to know about. This is of public health importance, which is why we've chosen today to talk about it. For information purposes, July 28th was the World Hepatitis Day, and the theme is hepatitis can't wait. So today we've decided to invite a guest over to help us break down, demystify hepatitis as it were. So with me today is a medical doctor, Dr. Kenechi. She, like I said, a medical doctor, a clinical researcher, with over 5 years of experience in clinical medicine, health education, health promotion, healthcare management. So she's here today to help us do justice to hepatitis. Dr. Kenechi, you're welcome.
Thank you very much. How are you doing?
I'm very fine, thank you. I'm very fine, thank you. All right. I don't know if you also want to say some other thing, as a means of introduction for yourself, or should we just go into the topic straight on?
Let's just go straight to the topic. I can't wait.
Okay, all right, that's good. All right, so hepatitis. Can you just give us a brief introduction about, what is hepatitis? Just the way our viewers will understand, just help us break it down, general overview about it.
Okay, hepatitis is the inflammation of the liver. So, and the liver is a vital organ of the body. So, when this liver is damaged or inflamed, it affects the body's way of the nutrients, this way of digesting nutrients occurs, and also filtering the blood and so many other things that the liver serves as this function. So when someone has hepatitis, it can cause serious liver damage. And when there's serious liver damage, it not only affects the person acutely, some kinds of hepatitis can even go on and affect the person in long term. So this is like a brief overview of it. It is very important because as of 2019, the WHO said that 200 estimated about 296 million people all over the world were infected with hepatitis B, and over 56 million people were infected with hepatitis C. As of today, hepatitis B and C is the seventh leading cause of death globally. So it's a big deal. It's quite a large number. So that's the reason why today we are trying to create awareness about it. We are here and we are discussing about it.
All right, thank you so much, Dr. Kenechi, for that introduction. So basically, when we say hepatitis, we mean an inflammation of the liver. That's
Yes, please.
some. Okay. So all right. So viewers, you got that. When you hear hepatitis, simply means the liver is infected, and the liver being a vital organ in the body, as she explained, there's a lot of things that could come up from that. All right. So I just want to ask a follow up on that. Now, what are the things? What are the reasons why, what are the things that could cause this hepatitis? I mean, are there classes of hepatitis, or what do we need to know about the things that can cause this liver inflammation?
Okay, the thing now is this hepatitis can be caused by viruses, and it can be caused by excessive alcohol intake, it can be caused by drugs, it can be caused by autoimmune disease, it can even be caused by some parasitic infections and fungal infections. So there are a whole lot of things that can cause hepatitis. But if I want to talk about the most common causes, I will focus on the viral hepatitis. So when you talk about viral hepatitis, they have about five strains of viruses that cause viral hepatitis. There's hepatitis A, B, C, D, and E. Those are the major viral strains. But in this our country, Nigeria, what is relatively common is hepatitis A, B, and C. Those are the three strains that are most common in our environment. So these
Okay.
strains are what causes hepatitis, known hepatitis we've been hearing about.
Okay. All right. So basically, can be caused by excessive alcohol intake, viral infections, and all that. But the commonest one are the viral infections. All right. So let's go to the commonest aspect. Since that's the one that affects people the most, like you explained. Now, you mentioned
Yeah.
some variants from A, B, C, D, E. Now, can you please explain to us what are the differences between these different variants and how do they affect the body individually?
Okay. So in our environment, I've already said that it's A, B, and C that is the commonest. So I'm going to center around those A, B, and C. Typically, when one is infected with the virus, if they are infected with the virus, the first phase is usually asymptomatic, meaning that the person may not have symptoms. So it's usually when you go and do a lab test that it will detect that you have the virus. Then after that phase, the next one is the prodromal phase. That is when some people come down with symptoms such as they could complain of nausea and vomiting. They could have muscle and joint pains. They could have abdominal pain, right abdominal pain. They'll complain about these symptoms: fatigue, extreme fatigue, weakness, and some people could even have itching, pruritus, itching in the body. And when they come down with these symptoms, they go to the hospital, and some of them don't even go to the hospital. They go to the chemist and they take malaria drugs and possibly treat for typhoid. You tell you it's malaria and typhoid, and they treat you like, okay, fine, this is what I'm having. So the symptoms are very similar to malaria and all those other common illnesses we have in our environment. So when they after having this phase, the next one, furthermore, they go what they call the etheric phase. And in this phase, they come down with pale stool and dark colored urine. So when you now have this pale stool and dark colored urine, it's progressive. For some people, the disease progresses further than that, while others experience resolution. The fourth phase, it just gets better and they recover, and the liver enzymes that get elevated become normal. So it's important to note that these symptoms vary from person to person. Not everybody will come down with the severe form of the illness. Some people that have just that are infected with hepatitis A and E, their their disease is usually mild. They have mild and self-limiting disease, and once they have the illness, they have a lifelong immunity towards it. They don't come down with it again. People with B, C, and D are usually more serious. They usually have more serious symptoms, but um, like I said, it could vary from asymptomatic, may not even have any symptoms, to mild disease, and then to some people will have severe and prolonged causes. So that is basically what the picture we see.
All right, just to even buttress what you said, being a clinician myself, people would come treat malaria, be like, doctor, I'm still not getting better, and all that, and they still keep treating malaria over and over again. And if they could just have done an hepatitis test, like you said, the symptoms you mentioned, the initial
Yeah.
phases, they basically look like our everyday malaria symptoms: the weakness, the fatigue, the fever, the body pains, and all that. So I think that pointer is just that after, if there's any of those symptoms, it's a good time to rule out hepatitis as well as a cause of those symptoms. All right. Okay. Now you've listed the spectrum of the symptoms, from those that don't exhibit any to as long as those that have the chronic illnesses. Now, is it all the variants of the virus that progresses to chronic illness?
So for you to have chronic illness, chronic hepatitis, the virus will be present in your system for at least greater than 6 months. So what happens is when you come the particular strains that has chronic infection B, C, and D. When you have those strains, there's a possibility that you could have a chronic infection. But for A and E rather, there's no chronicity to it. It's just those things. When you go to the lab, you do some tests. There's some things, some markers. Your doctors will ask you to go and do some tests. And if these tests are elevated, they're staying in your body for greater than 6 months, then you can know that you have a chronic disease. Some of these tests include we do a hepatitis C virus test, hepatitis B surface antigen, then the hepatitis C RNA test. When that hepatitis C RNA test is elevated in high titers, or the hepatitis DNA test, if they're in high titers in the body. So the B DNA test, surface antigen, the C virus test, and the C RNA test, when those things are in high titers in your body, after 6 months, then the disease is out there.
Okay. All right. Thank you very much, Dr. Kenechi. I just wanted to ask a follow-up on that. For the different viruses, how do they get into the system? I mean, what is the mode of transmission, so that we know what to be aware of, what to avoid, and all that.
Okay. Since we're talking about when we talk about transmission, that means we are focusing on viral hepatitis. I want to emphasize on it because I don't want my
Yes.
audience to think that hepatitis is just caused by viruses. It's also
No,
caused by alcohol and
we should talk about the
autoimmune
other
and all those
ones.
other things I've
Yes.
mentioned. Yeah.
Just to
So
finish the
if we're
viral
talking about
aspects.
viral hepatitis, what is the mode of transmission of viral hepatitis? For hepatitis A and E, it's usually fecal oral. In plain English, that is through contaminated water and food. Then, if you talk about B, C, and D, those ones you can get them through contaminated blood and blood products, sharing of toothbrushes and sharp like razor blade. If you share your toothbrushes and all those things, you can get it if the person is infected. Also, you can get through maternal child transmission at birth. Even a family member can transmit to a child at home. And finally, through sexual contact. So those are the ways you can get the mode of transmission of B, C, and D.
Okay. Thank you very much. All right. You mentioned sharing of sharps and as the mode of for transmission of hepatitis B, blood products for B, C as well. And then you mentioned the from mother to child transmission. So I wanted to ask now, just a follow-up on that. Just a follow-up on that. For someone that is infected and wants to give birth, is it always transmitted, or can it be prevented from getting to the child?
Yes, it's very possible that it's not always transmitted. The chances are neither here or there. It's a possibility
Okay.
that, but what happens is that if you're infected as a mother with hepatitis, you will speak with your doctor. Of course, the doctor is going to do a test on you and they see that you are infected. So what they do is, once the child is born, they place at the delivery room, they give the child vaccination, they vaccinate the child, and the further months from then, they also give 2 other doses to prevent the child from having hepatitis. So if this is properly done, the child is not going to come down with hepatitis. And I forgot. Can you hear me?
Yes, you're back on
Hello?
now. Yes, we can hear you. We can hear you.
All right. So I forgot to buttress on the fact that I've mentioned the modes of transmission. I skipped the fact that if you use contaminated medical equipment for medical procedures, you can also. So it's important that when you go for medical procedures, you ask them if the equipment are sterile. You have to ask tattoo. If you're going to have a tattoo,
I was
that
going to
equipment has
mention
to be
that.
sterile because it could be contaminated with hepatitis B. So those are the stuff I skipped earlier. Also, you can't get hepatitis B or the other hepatitis by hugging somebody or sneezing or coughing. You can't transmit it to those other. B can be present in the saliva. You can't get it by kissing or sharing utensils. Just to be
Okay.
clear.
Okay, but it can be transmitted sexually as well.
Yes, it can be transmitted sexually.
All right. So, someone that is now sexually active, we're just trying to hone down, on this viral hepatitis and, get through every aspect of it. Now, for someone that discovers that, okay, let's take it stepwise now. Someone that discovers that he or she is hepatitis positive. Now, I wanted to give us like an outline. What are the steps to follow? One by one, like what was the next step to do? What's the next thing to do?
Okay, so if you discover that you are positive, the next step to follow is to go to the hospital. And I'm going to divide it into two categories. You're positive, you don't have symptoms, and you're positive, you have symptoms. So if you're positive, you don't have symptoms, well, there's really nothing much you can do except you have to keep on eating healthy diets. Make sure that your diet is healthy so that your immune system can be strong. Take lots of water, do a lot of resting, make sure that you wear loose clothes, ventilated rooms, and all that. So just normal since you don't have any symptoms. But if you are symptomatic, you have to, of course, go to the hospital. And when you get to the hospital, your doctor is going to treat you based on your symptoms. If you have body pains, they'll give you some painkillers for your body pain. If you are vomiting, they'll give you something to take care of the vomiting and the nausea. So based on your symptoms, your doctor is going to treat you. Then, like I said, in most people, this resolution after the ecteric phase, it's everything comes down. But if it becomes more serious than that, if it enters into if there are complications, because your doctor is going to treat you based on the complications you are presenting with. So, other ways, if you are positive, symptoms or no symptoms, the like I said, without the symptoms, you don't really need to do much apart from just general well-being, taking care of yourself and all that. But if you are symptomatic, go to the hospital. Your doctor will take it from there.
Okay, so there's this one question I've always gotten, in hospital settings, like, when someone is diagnosed as being hepatitis positive, and they ask, doctor, is it curable? Can you disappear from my system and all that? So I'm pushing that to you now. So, Dr. Kenechi, can you give us an answer on that?
To be honest with you, to be extremely honest with you, hepatitis is okay. It's not exactly curable. It is not curable, but there are certain things you can do that can help take care of your symptoms. It can be managed palliatively. There's what we call palliative management in medicine. So your doctor will make sure that they'll treat you based on your symptoms and your quality of life can be improved. So that is what I can put out there, that it is not exactly curable. It is not curable, but if you have the acute disease, the doctors can treat it based on your symptoms and make sure that you are well managed until there's a form of resolution. If you have the chronic disease, your doctor is going to place you on medications, antiviral medications, and some other drugs that can also help take care of your chronic disease, especially for hepatitis B and C.
All right, thank you very much for that response. All right, another thing again that I usually get, as a physician, these are the complaints that people come to us with, like, okay, now I've been diagnosed as being hepatitis B positive. I have a partner, and I love this person very much, and also I don't want to leave this person. So what is the next? What do I do? So I'm also presenting that to you. What do I do as a patient who recently diagnosed being hepatitis positive? What is the next thing to do concerning as regards my sexual partner?
Okay, what I can advise is you have to come out to your partner and tell the person that you're positive. That's the first step. Secondly, the person has to get vaccinated, full course of vaccination, not just the first one that you now. So the person has to get vaccinated. Furthermore, you have to practice safe sex. You use barrier methods like condom to have sex with the person so that you don't transmit the virus to the person. Except, of course, if you are planning to have children or you want to get pregnant. So that one is a different ball game. But if it's just casual sex, then the person you should use protected. You should protect yourself to protect the person rather, and the person should get vaccinated. So that's it.
Fully vaccinated. All right. So you've been
Fully vaccinated.
mentioning vaccinations and vaccinations. So I just wanted to ask, um, is it all the hepatitis virus that are vaccine preventable, or which ones are? Can you itemize them for us? Which ones are vaccine preventable
Okay.
among the spectrum of the viruses?
Uh, for now, what the vaccines that are available is for A and B, hepatitis A and B is vaccine preventable. The rest of them do not have any known vaccines for now. So it's just for A and B. The A, do I go further or for
Yes,
the
yes. So people will know how
okay.
the schedule of the vaccination works.
Okay, so that's all for hepatitis A. You take the it's just 2 doses for hepatitis A. You take the first dose, then after 6 months you take the second dose. Why that of hepatitis B, you take the first dose, then after a month you take the second dose, then after 2 months you take the third dose. So it's 3 doses. That's the schedule for hepatitis B. Yep.
All right, thank you very much for those answers. All right, so you've mentioned that hepatitis can result to chronic illnesses. So just to ask, what are the common chronic effects of hepatitis on the liver?
Okay, if you are infected with hepatitis B and C, there's a tendency that um, you that's chronically, if you're infected with it chronically, it could result to liver cirrhosis, it could result to liver cancer, the liver complications apart from just so is what they call hepatorenal syndrome, where it could also affect the kidneys. It could even go as far as affecting the brain, causing hepatic encephalopathy. So there are just so many complications at the
Wow,
long
so
run. That is why we are saying that it is the seventh cause of death worldwide. It's something that is very serious. It's a very serious illness.
thank you for pointing that out. So it's not something to be joke around with. If you've not been vaccinated and tested, it means you have to go get tested and get vaccinated as well. All right, so now to another cause of hepatitis. You mentioned alcohol, because I'm sure that also relates to most, if not all of us. All right, so I learned, or I saw somewhere that the liver is, or we all know the liver is self-healing and all that. So at what point, does the liver, do we keep insulting the liver up to before we can, the effects of alcohol can be seen on the liver as alcoholic hepatitis? I just want to just give, a brief overview about that one.
So the liver is a very beautiful organ. I know why I'm saying this. I consider it a very beautiful organ compared to the rest, like the kidneys and the heart, because it's a very patient. I think I see the liver as a mother. You hit the liver, you're like, okay, I'll repair myself. You hit it again, like, okay. But there's a way you hit the liver up to 70%. That is when you start seeing the damages up to 70%. So that's how patient the liver is with us. Very patient. So we should stop abusing the mother liver by taking excessive alcohol that we enjoy it, because the liver could be patient, but when it finally fails, the consequences are very, very dicey. So that is all I have to say about it. 70% damage before we start getting the symptoms.
Okay. All right. Why I'm saying this is, you see some people the roadside, they just buy this early in the morning, just take like 3 or 4 hot drinks. I don't know the names. Take the bottle, just down it on empty stomach, do that again at night and keep, doing this over time. So like you mentioned, over time, the liver is a very patient organ, but if that abuse continues, it can lead to shutdown of the liver when more than 70% of it of it is hit. All right, so another thing that you mentioned earlier, tattooing and sharing objects. Now I'm putting it in a practical scenario now. I want to probably get a tattoo or get something that's is invasive. Do what do I how do I communicate that I want these things done to prevent the spread of the hepatitis virus? I have to tell them they have to sterilize and all that.
Yeah. So are you talking about someone that is infected or someone that
No,
just wants
sound
to get a tattoo?
yes, that's because tattoos are becoming, an in thing now, but it's not, I don't think people regularly just walk in and say, have to sterilize whatever you're using, or how do we do that?
Okay, so when you get to the place, you have to ask questions. You ask them about the sterilization. How long was it last done? Was it done? You could even ask them to do it in your presence because they are paying for the services, so you can demand for them to do it in your because they could lie to you. They could have machines that are not working and they'll tell you they sterilize it. So it's actually safer to get them do it right in front of you. Like they should do it when you are at that moment before they start the procedure. So that's what I can advise if you're going to, and not just about tattooing, even medical equipment, people who go to have dental procedures and all that. So it's imperative that you demand about these things. Are your equipment are they sterilized and before they use it on you?
All right, so thank you for that response. Um, all right, so if you have any questions at the moment, you can start sending them in. But one other aspect that we're talking about is, after now for me now, I'm not infected. I've just learned about this. All right. So what do I do? What are the things to do, before I can get vaccinated against hepatitis? What are the steps, basically?
Okay,
Just the
prevention.
spectrum.
I think you are
Yes.
talking about how to prevention, yeah?
Yes,
So
prevention.
I think I cannot overemphasize on it. They're just very simple things to do not to get infected by hepatitis. So I'm going to run through all strains. I'm not going to segregate it. So when it comes
Okay.
to hepatitis A, wash your hands very well with soap and water before you eat your food. Once you are out from the bathroom, wash your hands. And before when you come in contact with blood or body fluids, wash your hands. If there's a blood spill around you, use diluted bleach to wipe it off. Diluted bleach to wipe it because it kills the virus. Then we talked about sterilization of equipment. I don't want to overemphasize on that one. Do not accept unscreened blood or blood products. Do not accept to be transfused with unscreened blood or blood products. Then sexual intercourse. If you are having sex, use practice protected sex, use condoms, or you can practice safe, complete abstinence. That way, you will never get contact with it. So that's another way you can prevent it. Then we've talked about mother to child transmission. If the mother is infected, you should discuss with her doctor about it, and once the child is born, the child should receive vaccinations. That way, it can be preventable. Constant screening. You can go to the hospital, to the laboratory. If you come to us at Clinica-Lancet laboratory, we'll screen you for um, the hepatitis, all forms of hepatitis if you've not had the disease or you already have the disease and you are scared that it's a chronic, it's already in the chronic state. So we do all those panel tests there. So those are the ways you can come, get your screening test done, and that's it. So these are the ways you can prevent yourself from, of course, vaccination, very important. Get
Vaccination, yeah.
vaccinated for hepatitis B and hepatitis A. Those are the ways you can prevent yourself from getting the viruses.
Okay. And if, like we've explained earlier, if peradventure after all this testing, it comes out being hepatitis positive, there are still steps that you can take, like you highlighted earlier. If there's no symptom, basically it just means live a healthy life, take care of yourself. This is not the time to start binging on alcohol. Practically love your liver. That's what's the next step to take if the person is diagnosed being positive. And if there are symptoms, get to a hospital, let the doctors manage your symptoms, and then start the treatment for you as well. All right, thank you very much, Dr. Kenechi. All right, like I said earlier, if there are any questions that viewers have, we can put them on the chat and all. All right, so there's one other thing that comes to mind as well. Now, there's a lot of advocacy for HIV as it were. Now, I'm not saying HIV is also a disease of public health importance, but then when people hear hepatitis, they be like, what is that one? That one is not, is HIV that's. So now between both of them, now I'm not, of course, I know HIV is still a disease of public health importance, but between the both of them, which has a higher rate of infection? I mean, a higher
Okay,
infective rate.
I'll put it out there. Hepatitis is 50 to 100 times more transmissible than HIV, 50 to 100 times. So you're more likely to catch hepatitis than HIV, 50 to 100 times more. So it's very serious. It's very serious.
Okay, thank you for that, because some know this is why we are doing this. People would know that this is actually a very serious disease of public health. It's also said that even 2 in 3 people, carry the virus even without knowing they actually do carry the virus. And I think that is where the testing, even if you recommend it as part of annual medical screening as well.
Definitely, definitely, definitely. All my patients that come here, we practice preventive health care over here. So, most of the patients that come to us, we do screening tests for hepatitis B, hepatitis C, because you may be asymptomatic carrier, you don't even know. So we do all that so yeah, you can be aware if you have those symptoms. You not start blaming malaria and typhoid. Malaria has suffered in Nigeria, so you will not start
You can.
blaming
And when in
malaria and
doctor
typhoid.
when in
You will know that
doctor
okay,
treats.
that you know that this is what is actually wrong with you. So it's recommended that this screening test is done annually. Also, as the pre-employment test, it should be part of it.
All right. Thank you so very much. And I can do a Clinica-Lancet, right?
Yes, we carry out all forms both for acute illness and for chronic diseases. Mm.
All right. All right. Thank you for that. Okay. All right. Like I said earlier, there are questions attendees have. Please put in the comments and all. All right. Another thing that I would just want us to just talk about very briefly. Okay, is do these can someone be infected with both hepatitis and HIV? They're not mutually exclusive, right?
No, they're not. You People often come down with. We've had patients that have both hepatitis B and HIV. In fact, people living with HIV are more prone to coming down with the virus. And not only that, they have a more severe cause of the disease. Their symptoms are not mild. So that is why even if you're living with HIV, doing hospital visits, you're also advised to practice safe sex so that you don't contact other STIs like hepatitis B. Because when you have both of them, there's a possibility that it could really affect your quality of life. It could come down with the severe form of the disease. You can have what we call acute fulminant hepatitis. And acute fulminant hepatitis is a form of liver failure and can even affect the brain and encephalopathy. I had a patient who, um, 2 years back, came down with, he was HIV positive and he also had hepatitis B. So he came down with that hepatic encephalopathy. So it's something very. So if you are living with HIV, you need to even be more careful. You need to use condoms to prevent yourself from catching these viruses.
All right. So the final aspect I want us to look at is are there drugs that can also lead to hepatitis? I mean, we live in an age where there's a high incidence of drug abuse, and also are there drugs that can lead to hepatitis as well
Yeah, sure, they
that
are
can
drugs like,
affect the
and
liver?
it's even the common drugs that you see people take all the time, like NSAIDs, diclofenac, aspirin. Those things are, I would advise
Okay.
you to. I always tell my patients when they come in, please, painkillers are not gum. Don't. If they're not gum, don't always take them whenever you have any slight pain. You're popping it without prescription. Since it's an over-the-counter drug, so those medications can affect the liver and so many other medications, hypertensive medications, and some anti-diabetic drugs that can also affect the liver. But chief of them is non-steroidal anti-inflammatory drugs, because those are the common ones that can be bought over the counter. So um, it's advised that you take them with only with prescription, and just don't abuse it.
Oh, all right. Thank you. Thank you for that. So that means that for drugs like paracetamol, you don't do things like, I didn't use my dose in the morning, I didn't use in the afternoon, so I decided to use 6 or 8 at night. So as to catch up with the
Definitely,
pain I'm having.
paracetamol. How did I not mention paracetamol? Paracetamol can cause liver toxicity. So please, I especially mothers. I don't know if we have mothers in the house. Mothers in the house, please stop giving your babies. It's so bad that some mothers give their babies 5 doses of paracetamol syrup in a day. I've had it's just like I think they're giving them. They're like, oh, she's fine. Maybe she's having tooth pain. They'll give one dose. In the evening, she's having
Paracetamol,
tummy pain. So please, these things can affect
another
the
one.
liver. It can affect the liver and cause toxicity. So please, mothers in the house, and not just mothers, people out there, don't abuse paracetamol. Overdosage of it can um can affect the liver and cause about toxicity.
All right. Thank you so much for clearing that up. So, like you heard, people, please do not abuse, over-the-counter medications for pain relief. NSAIDs, paracetamol, they have their effects on the liver. The liver is forgiven, or it gets to an extent that forgiveness would come to an end, and the effects are not so good. All right, so I don't know. Do we have okay? We have okay. All right. 1 second. Okay. All right. All right. So Dr. Kenechi, on another note, we've talked about the drug-induced hepatitis. We've talked about the alcohol-induced hepatitis, the viral hepatitis as well. All right, so you've given us tips about generally living healthy, avoiding alcohol, avoiding drugs over the counter. Is there any other form of hepatitis where is there any other one that you're aware of that is of public health importance outside these three, which I think is the major ones that are common to us in this age and
Yeah,
time?
so these ones are quite rare, but we can't exclude them. Also, immune diseases. People who have systemic lupus erythematosus, they can actually come down with hepatitis. Autoimmune rheumatoid arthritis. So you usually when you go to the clinic, your doctor will ask you to do a liver function test if you have that SLE and all those other things, and you find out that they have elevated liver function, liver enzymes. So those autoimmune diseases can cause hepatitis, and honestly, those ones are not preventable; they just happen. So I can't tell you do this to prevent them. However, A healthy lifestyle is still a healthy lifestyle. Then there are some parasites and fungi that can cause hepatitis, but they are very rare situations where you get them affecting the liver.
All right.
That is about
Thank
those
you.
other rare causative factors.
Okay. Thank you, Dr. Kenechi. Okay. All right. So, sorry. There are some questions that I just want us to quickly go through. All right. So someone is asking, is hepatitis curable? I heard there is no cure for it. I think you've addressed that. Maybe just give a quick recap on that again.
I have said that it is not exactly curable. However, hepatitis A and hepatitis E, they have very mild disease presentation, and they can just resolve on their own. They're self-limiting. They just go on their own. So those ones can just go like on their own. But for B, C, and D, it is not exactly curable, and it can go ahead and become long term.
Chronic. Yeah.
So what's chronic long term? So your doctor will manage you based on your symptoms. They'll give you medications that will help you take care of your symptoms. And hopefully, if you are among the category of people that do not have chronic diseases, it just resolve the resolution. While for those who have chronic illnesses, there are medications that are given for antiviral drugs that the person will be placed on. There is some other drugs that the person is going to be placed on. So that's it.
All right, thank you for that. All right, so another participant is asking them, I've taken 2 doses of HBV, but missed the due date for the third dose. Should I still go ahead and take the third dose or start over?
No, don't start over. Just go ahead and take the dose. Don't need to
Two
start
doses of
over.
third dose. Okay.
Yes.
Well, is there like
Go ahead and
a limit to the time interval before a person will be required to start over, or just at any time person can take the third dose?
usually it's advised that if after the second dose, you shouldn't take more than 2 months to have the third dose. But if it exceeds, let's say, 8 months or 1 year, then you may have to start over again.
Start over again. Okay, all right. Just to clarify that. Thank you very much. All right. So someone else is asking, are you saying one can still have hepatitis B virus during intercourse, even when your partner is vaccinated? I think
The vaccine works perfectly well. So if your partner is fully vaccinated, the person may not come down with the virus. Let's give it 99% chance of
99%.
not getting 99% because there's nothing that is 100% in medicine. So
Exactly.
there's 99% chance that the person might not come down with the virus if the person is fully
Fully
vaccinated.
vaccinated. Emphasis on
Fully
fully vaccinated.
vaccinated. Yes, emphasis on it.
All right. All right. So another person is asking, are vaccinated people immune to the infection?
Yes, they are immune to infection. It confers immunity. The vaccination confers, especially when, like I said, fully vaccinated, it confers immunity. And also, if you've been infected with hepatitis A and E once, you have full immunity towards the next time. You won't get infected again.
Okay. All right. Thank you for that. So someone else is asking them, when one is a carrier, can he or she transmit to a partner? I'm guessing person is saying when you're an asymptomatic carrier, can you transmit to a partner?
100% you can if you're having sexual intercourse. I noticed that we didn't really talk about the impacts of, I don't know if the question is still coming. We didn't really talk about the impacts of hepatitis on sexual health.
Sexual
Is the
health,
question still
yes.
coming or I should go for
Yes.
it?
Yes, you can go. You can go for it now. You can. This is
All
go
right.
for it.
So
Is that person?
um if someone is infected with hepatitis B, C, and D, there's a likelihood of transmitting it to your sexual partner if you're having unprotected sex. So what is advised is that you practice protected sex with the person or you can abstain. Also, what is also advised is that the person should be fully vaccinated. Those are the ways to go about it. And hepatitis B virus does not really have any genital symptoms. Does not come down with, and there's no genital symptoms attributed to it.
There's
However,
no pain when you
the
win.
body, the, sorry, you're saying something.
Yeah, I said there's no the regular pain when you urinate or itching
Yeah,
that frustrates with sexual STIs.
exactly. So then there's no genital symptoms. However, the burden of the disease can cause a lot of anxiety and depression on people. Especially people who have it chronically, people who have had the disease for a long time. You see them, they're very anxious. Some of them even have depression because they are just tired of living with this disease. And when this happens, it can affect the libido. Depression can affect the libido. It can cause low libido. Depression can cause erectile dysfunction. So that is the way it can affect somebody's sexual health. And that is why we are singing this music. This prevention is better than cure because it's not. It's these things are all related together.
Thank you for that, Dr. Kenechi. So another question is, what is the lifespan of the vaccine?
I just said that it's lifelong.
It's for life, basically. So
For life.
yes, lifelong. All right. So someone else is asking, do you need to be vaccinated if your partner or family member is a carrier?
Among the mode of transmission, I said a family member can transmit to a child. I mentioned it as one of the mode of transmission. So if someone in your family is a carrier, if your partner is a carrier, please just go and get vaccinated. If you just go and get vaccinated.
All right. Okay, so someone else is asking, during the course of treatment, doesn't have to abstain from intercourse with his or her spouse.
Well, you can transmit the virus even during treatment. You can transmit the virus. So abstaining from your spouse, I don't think you should abstain if you're using condoms. But just to be on the safe side, you can decide to abstain. But if you're using condoms and if your partner is vaccinated, I don't think you need to abstain. That's the way I can put it.
All right, thank you for that. Another question is, okay, if you take the first shot of the vaccine and do not complete the dose, can that make you hepatitis B positive when the blood is screened?
No, it can make you positive. However, look at it this way: when you go to the lab to go and do a test, your antibody test, it depends on when you even do the test. Like if you got the vaccination today, in the next 1 week or if you do an hepatitis antibody test, of course it's going to be some titers because you got vaccinated. I even advise some of my patients that once you get vaccinated, we say that you didn't take a placebo or whatever the vaccine that you took is not fake. After the vaccination, you can go and do an antibody test to be sure that yes, this thing is really working. Can you hear me?
Yes, I can
Do
hear
I
you.
go ahead?
Yes,
Okay.
please go ahead.
So to be sure that this vaccine is really working, you do that antibody test. So if you go to the hospital and you do a hepatitis antibody test, it's going to be positive. But if you do a surface antigen test,
Test.
no. If you do HBV core antigen, there's what they call HB and core antigen test. If you do that one, it's going to be negative. If you do a DNA test, hepatitis B DNA test, it will be negative. If you do hepatitis RNA, so those are that. There's a whole panel of it that we do at Clinica-Lancet. So if you do all those things, they're all going to be negative. It's just the antibodies that will be elevated.
Okay, so that means basically to diagnose the hepatitis B, the surface antigen test is what should be done.
Yes, to diagnose hepatitis B, what you can do is a surface hepatitis B surface antigen test. You can go further and do a core antigen test, hepatitis B core antigen test.
All right, thank you very much for that. Another person is asking, can hepatitis be misdiagnosed as malaria during a malaria lab test? And also, do you think someone who treats malaria every month should go get tested?
Absolutely. Absolutely. We talked about this earlier. It's easily misdiagnosed, especially if you don't have the etheric phase, if you don't have those pale too and dark colored urine or jaundice in your eye. So if you are still
Yes.
one of those people who does end up in the prodromal phase, often it can be misdiagnosed. Especially people, most people don't even go to the hospital when they have these symptoms. They just go and take malaria drug, or they just go and take typhoid antibiotics, amoxicillin, very common. They abuse these medications.
Anti-clocks.
You take them, and so it can. If you're having malaria every month, you know what? That is not malaria. Honestly, I'm telling you the truth. I don't think you're having malaria. You could be having some other stuff. So go to the hospital. And if you think that the hospital you are going to is not giving you the right treatment, you can go for a second opinion. Go to another place. Don't be stuck to one place. And go and get tested for hepatitis B. Don't end with getting tested for hepatitis B too. You can do hepatitis A. You can do that of C. Just to be sure that, because you can go and do for B and it will be negative. You don't say I don't have hepatitis. Meanwhile, it could be the other things that you're positive for.
All right, thank you very much for that. Another interesting one. Can one contract the disease via kissing?
I talked about this earlier on, but let me just reiterate on it. Yes, hepatitis B is present in the saliva. However, you cannot get it through kissing. You cannot get it through kissing. You cannot get it through sharing of utensils. No. But listen, if someone has an injury in the mouth, and you have an injury in the mouth, and you kiss the person, have you may get contaminated, or you can
Infected.
become a carrier rather. So that is what I'm trying. The point I'm trying to make, like it is a form of injury in your mouth and that of your partner, and you kiss. There's a possibility that it could happen. And fecal, oral sex, you can get it. You can get infected with oral sex.
All right, thank you very much for those reply. I think one other one, which may be one of the final ones that we're taking, saying, can alcohol and drug-induced hepatitis go away on its own if those abuse are stopped?
Depends on how much damage has been done already. Depends on how much damage. If the damage to the liver is not um so bad, not up to that 70%, the liver heals itself. If it's just like 10% damage, the liver can um take care of that. So yes, it can go on its own. Depends on the damage, and of course, if you take medications that inflame the liver, once you stop those medications, um, that takes care of it.
All right, thank you. Thank you very much. Okay, I think some of the people are asking about hepatitis A vaccine, how many doses? I think you mentioned you talked about that earlier. Okay, they're also asking them where can they get the vaccine for hepatitis?
Oh, should I answer that? Should I go ahead and answer that?
Oh, you
You can
can.
get the vaccine at most hospitals, most primary healthcare, teaching hospitals,
Fantastic.
hospitals around you. You can just walk in there and ask to get the vaccination. Ask to get the vaccination. So that is about that. That's for the hepatitis B vaccination. Hepatitis A, same thing with hepatitis A, but not all hospitals give that. So you just I would advise to go to more of government owned hospitals. I think most of them are the ones that have the vaccination for hepatitis A.
Okay, all right. Okay, there's one interesting one here. All right. Person said I was diagnosed in 2013. I was misinformed and started taking treatment even when my viral load was 90, which wasn't necessary for at then. I started treatment for the past 2 years and stopped in March this year after my viral load became less than 10. So the person is asking what's next to do.
Okay, at this moment your viral load is very small. It's almost negligible. So what I can advise you to do is you avoid things that can inflame your liver. Avoid things that can worsen your situation. Things like alcohol, you stay away from it, you avoid it. paracetamol, excessive paracetamol overdose intake. So anything that can hurt your liver at the moment, you stay away from it so that it doesn't how would I put it, doesn't inflame your liver and bring about anything. Then eat healthy, eat a balanced meal. There's no particular diet for hepatitis. So the same thing I will advise a healthy person to take is the same thing I would advise you to take. Take balanced carbohydrates, protein, fruits, and vegetables. What is even recommended is 5 portions of fruits and vegetables every day. And
Oh,
it may
five
sound
percent.
mechanical. You know, when you tell people 5 portions of fruits, you don't like, this one is pretty, this one is 5 portions of. So how do you go about this? You can throw in apple in the morning when taking your cereal. You can throw in apple or a finger of banana. In the afternoon, instead of snacking on meat pie and cake, you could snack on watermelons and pineapples. In the evening when you're having your rice and stew, or if you're having anything with you can throw in carrots, cucumbers, and green peas into your stew. So that way you're taking vegetables and you're not it's not mechanical. It's just you're having what you eat and you're also taking in fruits and vegetables. So that is what I would advise you. Avoid things that can inflame your liver, like alcohol and paracetamol and those other things that can cause liver toxicity, and eat a balanced meal. Take
Thank
lots
you
of
very
water,
much.
lots of water.
What as well. Thank you very much. Okay, there's just one. I think this may just be the very okay. There's this one that's a good day. It's two parts. Is there any injection that a positive pregnant woman should take to prevent transmission to the baby? And also, can an hepatitis B carrier breastfeed?
Okay, I should have mentioned this earlier. You can't transmit hepatitis B through breastfeeding. So you can breastfeed your baby. Please breastfeed your baby. You can't transmit it through breastfeeding. And if you're a carrier, for now, no, there is no injection. I don't think there is an injection. I stand corrected, but for my last research on it, there's no injection that a woman can take to prevent the baby from. But what I have emphasized on is once the baby is born, the baby should get vaccinated from the delivery room.
Something
Should
different.
get vaccinated from the delivery room, then subsequent vaccinations, 2 other doses to protect the baby from getting infected. There's something I need to mention too. I before I forget, also an important piece of information. That is, if for instance, you are exposed to the virus, if you're exposed to hepatitis B virus specifically, maybe you are involved in an accident that made you exposed to accident victims' blood, and you're not sure of their status, or you know for sure that they have hepatitis B. Maybe it could be your friend that you know the person's status. So what can you do to make sure that you don't get infected with the disease? So one of those things you can do is you go to the hospital immediately. They'll place you, if you have not been vaccinated, they'll place you on the vaccination, and that will confer long-term protection for you. Um, then you can also be given what they call the hepatitis B immunoglobulin. They'll give you that one. What that one does is that it gives this short-term protection, and before the vaccination kicks in, it gives a short-term protection. So those are the ways. Those are ideally the kind of things you if you're not infected and you've been exposed to someone who is infected and you want to immediately make sure that you're not. So those are the things you can do.
All right. All right. So thank you very much, Dr. Kenechi. I'm sure we still have a lot of other questions that we want to ask. I don't know, do we still have some more time? Okay, all right. Okay, I think we can just take one very last one. One very last one. Okay. People are still asking about vaccination. I think we've ironed that out. Transmission to sexual partner. Okay, where vaccines can be taken. All right. So I think okay. If I've been vaccinated once, can I use it throughout my entire life? I think we've said that yes, that is that is what's going to happen once you are fully vaccinated. Once the summary is you are vaccinated for life as well. Okay. All right. So I've been told time is up. Thank you so much, Dr. Kenechi, for being with us today. Thank you so much for breaking down hepatitis. It was nice having a session with you. I don't know if you have any
Thank
final
you for
notes
having me.
to our participants out there.
Okay, final note. Hepatitis is not a death sentence. Despite the fact that it's not curable, you can live, your quality of life can be improved by adequate management. So if you're infected and you're symptomatic, go to the hospital. They will place you on medications that can treat it. And of course, prevention is better than cure. So all those things I've listed seriously, try to follow them so that you don't come down with the disease. Get vaccinated, and most importantly, avoid things that can inflame your liver, which is not by caused by the virus. Alcohol intake, you have to make sure that you don't abuse it. So that's the final note I have for you. Routine screening. Go and have your screening test for hepatitis viruses.
All right, so thank you very much, Dr. Kenichi. So you heard it from her. Number one, go and get tested, know your status, very important. Number two, get fully vaccinated, whatever it is. And number three, it's not a death sentence, it can be manageable. All right, so you can also get this video on YouTube channel at Avon HMO, and also on our social media platforms on Instagram and Twitter. All right, so thank you so much for being with us today. Thank you, Dr. Kenichi, once again, and have a lovely day.
You too. Thank you for having me, Kola Koladia. Thank you.
Yes, Kolawole. All right, thank you.
Kolawole.
Yes, yes. All right,
Yeah.
thank you very
Bye.
much. All right, bye-bye.
Okay. Bye.